You're listening to The Local Lens, the podcast from the Powell County Health Department and Kentucky Rio, where we go inside our community's experience with the drug epidemic.
From the EMS side or the coroner side, it is the worst that we've ever seen. And I said that a year and a half ago, 2 years ago, and it's gotten worse. Okay. And looking at it from the aspect of, I go back whenever I started in EMS, we would give Narcan 0.4, maybe 0.5, half a milligram of Narcan. And that 0.4, 0.5 would bring somebody right out of it because the drugs that they were taking at that time was a different animal, let's say. And nowadays, it is unbelievable the concentrations of the opioids that we're seeing, the designer drugs that we're seeing. Some of it we don't even know what they are, and you're seeing one of the biggest areas we've got here, and I'm sure it's probably the same in Powell and further east you go. We're seeing a lot of meth. And we were seeing a lot of meth that's mixed with fentanyl, and you're seeing a lot of pills that are being stamped. We're seeing a lot of people who are purchasing what they think is a Lortab, or they think is a certain medication, and it's not. It's just a poison, basically.
And this is Jimmie Wise that you're hearing. He's the EMS director in Estill County and also runs the coroner's office. And he's got about 3 decades of emergency service experience behind him. This guy has seen it all on the front lines, and he's watched the development of how the drug usage has changed over the years. So I can't wait to get into this interview. You're listening to The Local Lens, the podcast from the Powell County Health Department and Kentucky Rio. Our show is all about gathering perspectives from a range of different places, and this guy, Jimmie Wise, just comes in with his guns a-blazing and baseball bats swinging, and he's hitting home runs. Really, this episode is packed full of information. We're going into what the EMS experience is, we're going into stress management, and also other different aspects where we keep our community healthy. So tune in and listen up, guys. This is The Local Lens. I'm your host, Nate Brooks. These are our people, using our voices, telling our stories, because no one sees it like we do. So would you like to introduce yourself?
Sure. I'm Jimmie Wise. I'm the director of Estill County EMS. I've been with Estill County EMS since 1990. I've lived here all my life. My family lived here. They had a business here in town. They started the Twin Restaurant here. I've still got that. I was with... started in emergency services, and I've hit about every aspect of it. I started with the fire department, rescue. I'm also with the coroner's office. I'm the coroner of Estill County. I've been with the coroner's office since 1995.
Nice. What's been your favorite of the emergency services?
I was a little concerned years ago when we first started, and my wife's the same way. We both raised here in the county. We both families had businesses here, and we were a little concerned at point. You're living in the town, working in the town, and you're going to be dealing with the people you work with every day, and sometimes that's not a positive experience. Sometimes they have bad outcomes. Sometimes there's situations where there's medical conditions or automotive, or sometimes things happen. So sometimes you get a little nervous, but it's been positive. It really has. Really enjoyed it, and I've been fortunate enough and really blessed enough to be able to work and live in the same community that I have been in all my life. So there's nothing wrong with driving to Lexington every day. There's nothing at all wrong with that. I admire people who work for a living. But at the end of the day, I have been fortunate being able to live here and stay in the county. Downside to that, 3 o'clock in the morning when somebody needs something, you're just down the street.
Yeah, so, yeah. Everybody knows where you live. They can come knocking on your door as soon as they need.
And it happens. It happens sometimes. And that's cool.
Yeah. It's kind of what you sign up for. I feel like.
It is exactly right. In Estill County EMS, we've got about 42 employees. Okay. We run 3 trucks, 24 on trucks, 24 on, 48 off. You come in one more crews come in the morning, get off the following morning. We do about 4,300 runs a year for Estill County. That includes everything: your transfers, your dialysis runs, your cardiac patients, your emergency 911 calls, all of the high profile runs. So we do a lot of stuff for a small town. Arguably, we try to be one of the best EMS services in central and eastern Kentucky, and then we train constantly on different aspects. We've got a great crew. We're a teaching institution for a lot of the colleges in this region, so we do a lot of ride-alongs. We do a lot of education. We do a lot of training.
And these guys really are praised by pretty much everyone that works with them, and they're good to work with, and that's good in this line of work.
We've got a great working relationship. Start with our hospital, Markham and Wallace Hospital. You know, we've had each other when there wasn't anybody here. You know, when you'd have that one doctor that was working part-time with that one nurse in the ER, so we had each other. And 3 o'clock in the morning, that's all you've got when emergency services is your fire, your rescue, your dispatch center, your police. That's all you've got is each other. So you learn to trust each other, and you know it's a family. And people keep saying that kind of, you know, kiddingly, it's a family. You know, there's some days when, you know, some of your cousins you kind of fuss with a little bit, but you got their back. Yeah. But there's sometimes when, you know, you have that bump in the road, but you know it's tight. It's a tight-knit group.
One of the big differences between Powell and Estill is you guys do have the hospital. We don't have the hospital here. How big of a difference does that make for you guys?
Oh, it's a big difference. Let's say, for instance, with Powell, if you were to run down to the corner and pick up a little lady who's having a little trouble breathing, that patient is going out of town in Powell County. You know, you pick them up in Stanton, Clay City, wherever. They're going to Clark County. If they're sick, they're going to UK. So they have to take everything they've got out of town. You know, we're fortunate if at 3 o'clock in the morning, if we've got a little lady down at the nursing home that's not feeling too well, we run down there, get her, run her up to the hospital. You know, 2 hours later, she's ready to come back. We're in and out, done in 30 minutes on each end. So that's something people don't think about, because when that truck goes from Clay City out to even Clark County or over here to Markham and Wallace, that truck's out of service for, you know, hour and a half. You know, so yeah, that's a big disadvantage, or I guess you would call it a disadvantage when you start getting into like Lee County, Powell County, when you further go east, when you don't have that hospital in your area, because you know that takes time. You have to put that in the equation when you're doing budget, because you know, hey. Yeah, and you look at Powell County, a lot of it is in the bluegrass region, but then a lot of it is also down in the hills and the hollers, and it takes time to go up in there, and as you've heard 1,000 times, time is money, and money is tight everywhere. Very easily, some of the areas out there where you go to, you could have an hour of transport, you know, and then you've got to still take them on to their destination. So you've got there's positives and negatives. The biggest positive in that type of scenario is you've got to be on your A game. Because you know you're going to have that patient, a sick patient sometimes, more often than not, for a long period of time. So you know you got to be on your A game.
And I have no clue what on earth a good solution to this problem would be. But for now, just keep in the back of your mind that is an issue that a lot of small counties deal with. Looking in then back at Estill County, what has the drug crisis been like here?
Well, you know, it's from the EMS side or the coroner side, it is the worst that we've ever seen. And I said that a year and a half ago, 2 years ago, and it's gotten worse. Okay. And looking at it from the aspect of, I go back whenever I started in EMS, you know, we would give Narcan 0.4, maybe 0.5, half a milligram of Narcan. And that 0.4, 0.5 would bring somebody right out of it, because the drugs that they were taking at that time was a different animal, let's say. And nowadays, you know, it is unbelievable the concentrations of the opioids that we're seeing, the designer drugs that we're seeing. Some of it we don't even know what they are, and you're seeing one of the biggest areas we've got here, and I'm sure it's probably the same in Powell and further east you go. We're seeing a lot of meth. And we were seeing a lot of meth that's mixed with fentanyl, and you're seeing a lot of pills that are being stamped. You know, we're seeing a lot of people who are purchasing what they think is a Lortab, or they think is a certain medication, and it's not. You know, it's just a poison, basically.
And fentanyl has been in the spotlight recently, and rightfully so. It's 50 to 100 times more deadly than heroin is, and a lot of toxicology reports reflect that. It's killing a lot of our people right now.
And fentanyl is not the fentanyl that we talk about in the hospital. It's the fentanyl, it's a bathtub type fentanyl. It's something that we see that they're making in Mexico. They're making it in this region. You know, it's something that they're throwing together. It's not the pharmaceutical grade stuff. And they're adding stuff to it that makes it completely just a poison. I mean, and it's really something that we'll see one time where they'll take a dose of this one particular drug and it'll completely knock them out, and the next time they'll mix it with something else and they'll be just screaming. I mean, they're just scared to death, and they won't be unconscious. It'll just work the opposite.
Yeah. So if you show up to a place and that's happening,
yeah,
what do you do then?
Well, key component on any call is scene safety. Historically, we try to make sure that everybody. We still do see a lot of needles. We're seeing a lot of needles. I'm an advocate of the needle exchange program. I know that's not neither here nor there, but it's when we go out on a scene, we're seeing needles. I want to make sure that if there's one chance in 1,000 that they've got a clean needle. If we were to get stuck, or if emergency service police get stuck, that it's hasn't been used 15 times. It's been used once, maybe twice. But one thing we look at predominantly scene safety. We go out, we try to make sure that we are taking care of the person the best we can, and sometimes that's administering Narcan, sometimes that's making sure they don't hurt themselves. Get enough resources there, and resources are being our police department, our volunteer fire, volunteer rescue, some people that can lay enough hands on so that if we need to move them, we can do it safely. If we need to control them, we can do it safely.
That makes sense. So if you've been around our show at all, then you've probably heard something about the Syringe Exchange program. But for those of you who are new here, who haven't heard of this program, we're talking about the Syringe Exchange. And this is where people come in and trade their used syringes and replace them with unused syringes. And it's a harm reduction practice, meaning that we're trying to reduce the harm done by drugs. We're trying to reduce the spread of diseases like hepatitis C and HIV. So Jimmie's going to tell us his side of it now.
Well, and there's a couple different schools of thought pertaining to the needle exchange. One of the areas that if you stop and think about, if you've got somebody from the cost basis alone, and we're just touch on that just for a hair, just from the money aspect from your liver damage, from your hepatitis, you're dealing with hundreds of millions of dollars going in the healthcare that's being pulled and strained because of the fact that we're transmitting certain diseases. Now, my number one priority is trying to make sure that our people stay safe. Now, our people meaning all emergency services, our police officers that go out, we train with them. We do a lot of CPR, first aid classes with all our services. And first thing I want to make sure is if there is a potential of having a needle stick, we want to decrease the chances whatsoever that could possibly be. Because, and sadly, we know, our families know, the grandparents know, the parents know that if they're using drugs, they are probably positive for different things, hepatitis being one of them. And I've been told probably, I don't know, dozens of times, let's go dozens upon dozens of times, where grandparents have come up to me like, hey, I know my grandson or granddaughter is using. How can I stay safe? Because I know that they've probably got hepatitis. I know they've got other diseases. How can I stay safe? And one of those avenues is helping to make sure that we have given them the right resources.
So if you're interested in going back and hearing some more details about the financial toll of the crisis, then you can go find our episode with Judge Executive James Anderson. We'll have a link to it here in the bio somewhere, wherever you're listening to us from, because that is a factor in it, and it's a reason to do the program as well. The health side of it, though, that's also very important. But looking back into your history, was there a specific event that kind of shaped how you view the whole drug approach?
Maybe, basically I'm taken back every day, and I can go back and look at several cases years ago, but it's probably been amplified considerably recently. I'm amazed at how many smart, hardworking, pretty, handsome men, women, kids that are actually educated who are actually addicts. And I get taken back every time when we deal with somebody who's like, hey, he or she's got a good job, they got a good spouse, they got a good family, they've just got a situation that they're having to deal with. And, begging us, hey, don't tell my wife. I've got a good job, I'll lose my job, and that's one end of it. And I know there's a stigma with addiction and all, and that comes into play with them too. But you forget sometimes whenever you're dealing with, I think this past weekend we had, I don't know, 12 overdoses somewhere from Friday to Saturday. I lost count at 7 or 8.
Yeah.
And you forget sometimes that, these are people just like me and you, where there are family members or our friends or our colleagues, or there's situations where you don't know or you may know their situation. And I look back even in my history, years ago in the late 80s, I had a bad motorcycle wreck. I broke everything I had pretty much. And this was pre some of those bad heavy-duty pain medications, the pre the really strong stuff. And I could have easily turned out and been an addict, easily, because a lot of the people that we deal with are to people who have pain. I mean, pain hurts. We got to do something about it. So we deal with the fact that they just escalate through the years, and they get to the point where they are today. And I could have easily been in that direction, OCs weren't, OxyContin wasn't out in the late 80s. It didn't come into that, but they would have put me on it. It's not a doubt in my mind, because I had everything broke: femurs, tib, fibs, ribs, nose, face, fingers, toes, everything. I didn't break my left humerus. I always like to point that out. I got a good humerus on that left arm. So, but I can't beat you in a running match. But I could have easily ended up in the same scenario, and it just, when you look back at the things, and even coming to today, we've got people we know in our neighborhood, of course you do in Powell County too, that that are just great people. They just got some issues, and addiction is a disease.
Yeah. So you just mentioned it. Yeah. It's a disease. So a disease or a choice, that's a big debate that goes on, that even people who are in addiction still have the debate between themselves.
Yeah, I see that.
So what do you think about it?
I kind of, it fits the criteria for a disease. It really does. I think that looking at it now, if you dig into it deep enough, you could probably give a good argument for both. I feel like it's a disease. I feel like that, and I even fall back to my dad. My dad was the smartest person I ever knew. And I know this is a little different. Smoking and drugs is completely on the opposite end of the scale. But Dad was the smartest person I ever knew. Brilliant. He could do anything. He was an engineer, a brilliant man. He just couldn't quit smoking. And he could do anything on earth he wanted to do. Now I know some people lay the pack of cigarettes down and don't look back. But I look at the aspect that it's kind of akin to the same areas.
Yeah. I mean, it's a nicotine addiction.
It's an addiction.
And at the end of the day, it did kill him too. I mean, that's one of the leading causes that caused him. But I think I'm leaning in the direction more of disease. I do.
Mm-hmm. Yeah. So one of the things that we were hitting on as we were just meeting earlier today was almost hitting like on burnout, when you have EMS workers, you have emergency responders. You're the director of this whole department. What is your role in kind of managing that burnout?
Well, burnout in EMS on the national standard is about 5 to 6 years. Okay. So like I said, we work 24 on and a 48 off. The crews that come on at 7 this morning at Estill get off at 7 tomorrow morning. And the divorce rate in emergency services, your police, your fire, your EMS is higher than most other types of fields. Mm-hmm. And burnout is a very it's something that is very real. Mm-hmm. You see the same things that you see all the time with people on the same runs on the same days. Yeah, I mean, and it's very real. I mean, because there's a lot of issues that you see time and time again and again and again and time every day, every week, every month. Mm-hmm. And you go out on certain runs, and you know what you're going when you get in on it. And sometimes it mentally it weighs on you. It does. And then we always try to find avenues to try to help with that in EMS. You notice when one of your friends. One of the colleagues there is kind of not acting exactly right because they've had a bad run, know, and today's and let me change gears to the millennials just for half a second. Okay. Millennials deal with things differently than I do, Mm-hmm. My generation was kind of like, we'd have a bad run or something, we'd go out in the bay, we all sit around, we talk about it, we'd kick it around. The millennials are not that way. The first thing they do is when they get back to station is they isolate themselves. They get on social media. They watch their movies. They play with their games. They go off to a corner and they do their things. I'm fortunate. My wife is involved in EMS, so we go home. We talk about things. When we were on the runs together, we never worked the same truck. We worked the same days at different stations, but we would always a lot of times end up at the same bad car wreck or the same bad overdose or the family member who had a bad situation. And it's burnout's very, very real. You have to find an avenue, and that's hard. You have to find an avenue of release. Vacations are very important. Going and taking a long weekend, going someplace. So it's it's something that we struggle with, and you're going to start seeing. We're seeing a lot of medications provided now for mental illness. We're seeing a lot of your emergency service people in mental illness dealing with that. So that's something that we're going to see more and more and more of.
And do you think that's appropriate, seeing the medications for it?
It's always great. You talk with somebody who knows more about it. Talk with your physician, talk and see. You're seeing, even from the aspect of the people who are addicts, we're seeing a lot of mental illness. That was the first phase. Is always dealing with the addiction, and then we're leading into right now. We're seeing a lot of mental illness with addiction. We're seeing a lot of mental illness people dealing with COVID. We were scared to death a year ago. We thought we were going to die if we got it. And so we're having to deal with that. So we're kind of coming out of COVID a little bit. I think more and more every day. And so in the back of my mind, one of the largest, and I think it's still, but I'm going to say it, but I think it's still the same way. One of the largest medications that's been written, the doctors write for, is for ulcers, and that's basically an ulcer is because your body's dealing with stress. So when you look at the aspect that one of the largest medications in the world is being written for, and again, I think it's still that way like it was about 5 or 6 years ago for stress. We can deal with heart attacks. Your body finds a way to deal with broken bones, heart attacks, strokes, but it doesn't deal well with stress.
And I feel like this is a huge thing that we need to be talking about, because we talk a lot about mental health now, but we don't just talk about stress management. This kind of points to you have to find healthy ways to manage your stress. For me, it's like walking and going on runs, riding, but you have to find a way to do that before you get an ulcer or before you turn to drugs to help relieve your stress for you. But we're about to change directions and start zeroing in on the coroner side of things for a bit. One thing, our coroner, Megan Davis, she told me that, I think this was back in February, over the past year, they had an overdose on the third day of every month. So, right after the paychecks would come in, they would have an overdose on the third, and I think that was, the spike of the month, too, on that day. I don't expect you to have the numbers on top of your head at all, but are there any strange patterns like that you've seen over here?
Well, Megan's right, and we see that here too. Any uptick in overdoses has a direct correlation with uptick in money. Whether it be whether they're getting their check or whether they're getting their stimulus check, or you'll see a big uptick in that area, and you see a big uptick in availability of drugs. If you have a big raid or a big bust and you shut a system down for a little bit, you have a big uptick after they kind of figure out other avenues to bring in said products or move said products around. But but you do see an uptick whenever you see finances come up, and we do too. Like I said, we've probably at EMS we're dealing with, it's not hard to say, 2 or 3 overdoses a day at times. Now you may go 3 or 4 days without any, and then you've got a weekend like we just had, which had several. So it's hard sometimes to put a pin on it.
So, but then one of the things that happens over here too is the overdose maps.
OD maps, right?
How does that help you guys?
Well, it's a tool, and we always look for every tool we can use in our toolbox. There's not any one that kind of works better than any of the rest sometimes, but you use them as a different avenue. And OD Maps is a tool we use, and I think several counties are picking it up, and then several states have picked it up, and a lot of your bigger cities.
So basically what's happening with these OD maps is every time an overdose is reported, then the location is pinpointed, and you also fill in the details of whether it was a fatal overdose or non-fatal, what the drugs involved were, all that kind of stuff. So then it plots the point on this nationwide map, and you can look and see on the map when certain cities are getting hit by lots of deaths or lots of overdoses. So if you're in Stanton, Kentucky, then you can see when Columbus, Ohio gets hit. And then a few days later, you'll see that Cincinnati gets hit. And then you'll see that Lexington gets hit. And then you know that it's on its way to you, so you better get ready for it.
And it kind of helps you prepare a little bit. It also, the maps can help you know that I need to upstaff, I need to be prepared. I know it's the 3rd of the month. I know it's 2 weeks after we've had a big, Cincinnati's been gotten hit. It's been a week since Madison County, because it's on I-75 corridor, the Beltway coming from north to south I-75. Anything north and south of there, it's a good jumping off point if somebody were to be supplying or supply and demand anything on the I-75. So we're just outside of that. So we'll see it in Madison County, and if it comes up the Parkway, like comes towards Powell County and goes on up north of there, or goes on up east of there, it comes in the back way. It'll hit Lee County and come in from that side. So if we get a lot of pressure in the Madison County shutting a lot of stuff down, it switches over to there. So it's a good tool. It's handy. It just kind of gives you a little bit of an edge, and in today's environment, a little bit of an edge is great.
And these OD maps are still pretty new to our area. We don't have them in Powell County at the time of releasing this episode, so hopefully it'll come around and we'll see if it helps. But we're right at the end here. Let's go in and wrap this episode up.
From the coroner's aspect of it, one of the big jobs, or one of the main, I guess, components is, trying to help family, and trying to go in that direction. And EMS too, we're there for the patient, we're there for that person to help them deal with that situation. Because you're taking somebody who's normally in control of their life every day. Like you were in control of your life. You were in control of driving over this morning. You were in control of, leaving the house and doing everything. But if you had a motor vehicle accident, or God forbid something worse were to happen, you need some assistance. And Powell County's great about that with their EMS, and Megan's great about that over there too. So that's one of the components. You're here to help the family as much as you are the person that's in distress.
Is that what drives you personally?
Yeah, that's part of the satisfaction of it, because if you let it get to you, if you let it, the fact that you're not going to be able to help or follow through with situations that's just beyond your grasp, and sometimes the best part of it is like, being able to guide the family in a direction that's helps them to deal with, because you're finding out questions and answers, and you're digging into things all the time to help them. So it's that would be probably one of the areas that's the satisfaction part of it, because dealing with the other end of it, there's not a lot of that can get stressful, and that can kind of get you down sometimes. But whenever you're dealing with a family you've known all your life, and you're saying this is what we need to do next, and I'm going to help you work through that, that's satisfying.
I love talking to Jimmie about this kind of stuff, because you can really see his heart come through on it. And his work is backed by all this objective knowledge, but then you can totally feel that sincerity that he approaches it all with. That's all the time that we have for our show today, though. Thank you so much, Jimmie, for coming on and giving your time to us. Thank you, WSKV, for broadcasting the show. Also, thank you for the Powell County Health Department and Kentucky Rio for letting the show be a thing still. If you're a listener, then find us on Facebook. Tell your friends to start listening. We really want everyone to hear this message. We think it's good stuff to know and to be aware of. This is all what's happening right under our noses. Anyways, that's all I've got for you today. I'm Nate Brooks. This is The Local Lens. These are our people using our voices, telling our stories, because no one sees it like we do.